There are many sleep disorders, and today we will talk about narcolepsy, KLS, and restless leg syndrome. Narcolepsy is a sleep disorder characterized by excessive sleepiness, sleep paralysis, hallucinations, and an episode of cataplexy or partial or total loss of muscle control, often triggered by a strong emotion such as laughter. It affects both genders equally at a 1 to 2,000 amount of people having it. Some symptoms for narcolepsy is excessive sleeping, sleeping during activities, and having hallucinations or paralysis when they wake up or go to bed, which normally shows up in childhood or adolescence, but many people have symptoms years before getting a proper diagnosis. This is caused by damaged or destroyed cells in the hypothalamus that produce hypocretin, which acts on the alert system of the brain and keeps us awake and regulates our sleep clock. There is no cures, but there are medications and treatments that can lessen the symptoms. Klein-Levin syndrome is a rare disease that is commonly found in men. Some of the symptoms are excessive sleeping, which happens in episodes, excessive food intake, irritability, childishness, disorientation, and hallucinations. People who have episodes will not remember what happened during the episodes and be perfectly normal when in between the episodes. The prognosis is, after 8 to 12 years, their episodes should not be as common. There is no treatment, but you should be watchful of them at home, but there are some pills that can help with sleepiness, but can cause some side effects. Restless leg syndrome, also known as Willis-Ekbom disease, causes a sensation in the legs and an urge to move them. Around 7 to 10% of the U.S. population may have RLS. RLS occurs in both men and women, though women are more likely to have it than men. Some of the symptoms are the urge to move and uncomfortable sensations in your lower limbs. But because moving your affected body part relieves you of this uncomfort, people who have this disease keep their affected limbs in motion to lessen the pain. Also, these symptoms get worse at night. Most of the time, the cause of the disease is unknown, but if you have end-stage renal disease, hemodialysis, and iron deficiency, use certain medications, alcohol, nicotine, caffeine, nerve damage, or if you are pregnant, most commonly in the last trimester, but most likely these symptoms will leave, RLS can be treated with lifestyle changes, iron intake, anti-seizure drugs, dopaminergic agents, opioids, and benzodiazepines.